I am Rob from iTech Pickers, and it's time for the coronavirus outbreak update. And we are Friday night, and we're gonna look a little bit about what should we plan for what is going to happen with that thing, because of course we are looking at the news and we can see that this is getting worse every day, and it's not gonna get any better. This is probably gonna last for a long time. Now, from now on, I'm probably gonna concentrate on what's happening outside of China because, frankly, I'll say it's frustrating because the more news comes out in the media and you realize just how much the regime in China has covered this up. Like today, we have heard that they have been aware of this thing since almost the beginning of December, and they have covered this up from the rest of the world, and it's disgusting. And that's the very reason why they have a crisis of this magnitude today, and they will never be able to control it. And they are still keeping the narrative, and you know we shouldn't be surprised because this regime has done that for 70 years. Uh, they've lied to the rest of the world. They have let millions of their citizens die and arrogantly lied to the rest of the world. So we should not be surprised that they are acting this way today. And if this situation never gets resolved, that same party is still gonna be there, and it's not going to change. So I'm not gonna bother talking about this anymore because frankly you know it's useless. Uh, make your own mind about the political reality of China, and but keep in mind that the numbers that are being passed around and by the mainstream media now today they're saying that there are like 720 people dead or 35,000 people infected in China. These numbers are complete garbage. Now, estimates coming from people who know China, who know what's going on there, and they see the unprecedented uh, things that are happening every day now. The trucks spraying bleach, on the buildings, on the people on the street. The mega hospitals with thousands of beds and the body bags. It's clear that the real estimate is that there are about 300,000 uh, people infected with the virus right now, and there are roughly about 10,000 people dead already. So, if you choose to believe the ridiculous numbers that are being passed around by the World Health Organization, the Johns Hopkins Institute, with their website, well, then do so. But let me tell you something: like you are a special kind of stupid if you believe these numbers. Okay, it's what's happening in China is something that the order of the magnitude of this crisis. It's like 700 people dead. You have to be joking, to actually claim or say that. Uh, the estimates, they're talking about like at least 10,000 people dead, and it's and they're cremating the bodies 24/7, and the bodies are being piled up at places, and you know, so you can't believe the narrative of of the Communist Party, and they once a day they make up some numbers and they pass that around to the people of the World Health Organization. And these idiots, these overpaid idiots, they take these numbers for granted and they publish that in the media. But these numbers are not accurate. So I'm not even gonna bother talking about China anymore. What I'm concerned about is what's in it for us and what's gonna happen to us, because this disease is going to spread to the rest of the world. Okay. So now I want to make some kind of a comparison with the other pandemic that we've had, and which was the Spanish flu pandemic of 1918. And I'm pretty sure, in my assessment, that we are going to have to live with something that's similar to that. Um, and some of the similarities, if you look at the case mortality rate of the Spanish flu pandemic of 1918, actually it came in three strains, so to speak. It first there first was a strain which was kind of weak, but then the second strain of the pandemic was absolutely that was an absolute catastrophe, and people dropped like flies, and so it's divided maybe in three strains, but overall it's difficult to assess what was the case mortality rate. But if you look on the internet, you have some people talking about 2.5%. Uh, some of them like speaking about 5%, or even like 10 to 20%. So if if you assess like the second strain of the pandemic, which was the worst, and especially in countries which at the time had absolutely no healthcare system whatsoever, like India, the case mortality rate was probably up to 20%. Um, but I looked at the numbers of the people infected by coronavirus outside of China, because obviously inside of China we will never get the answers. Uh, but if you look at the people who have died versus the people who have recovered, that would give you like a 5.7 case mortality rate. So that's higher than the lowest estimate of the Spanish flu, which was 2.5%. And it's people who died, within the probably the best health systems in the world. One of them died in Hong Kong. The other one died in the Philippines. So they had access to modern healthcare. So at the moment, from the real numbers that we have, it's 5.7% case mortality rate for the coronavirus. Of course, it's not what is being told to you by the World Health Organization. They say it's 2.5%, but for the moment, these guys have lost all credibility. Okay, so I'm not gonna quote them. I'm gonna do my own research. So so you have the disease with a case mortality rate of 5.7%. Now, if you look at the R naught, which is basically the speed or the rate of contagion of people, um, it is said that the R naught of the coronavirus is about 4. Now, if you look on the internet, the R naught of the Spanish flu, it was about 1.8. So the coronavirus is more contagious than the Spanish flu was. So this has a big, um, this has a big impact on the speed at which this disease is going to be spread, and it can be found on doorknobs, it can be found on toilet seats, and the most important part is that people who are not who don't have any symptoms, who are asymptomatic, are spreading the disease for for up to 14 days before they even get any symptoms. But they spread the disease around. So you have these healthy people who are nobody knows they are infected, but they are infected, and they're spreading the disease around to other people. And these other people who are completely healthy are spreading the disease to other people, and and so on, and that goes on in an exponential way. In in the Spanish flu, it didn't happen this way. Uh, it's debatable that the Spanish flu was not even contagious by asymptomatic people. Usually, when people were infected, they would get sick very fast and died very fast. Sometimes they would get infected in the evening and they would be dead the next morning. Uh, it was very easy to see where the infection was, but in the case of the coronavirus, people can be asymptomatic for up to 14 days. They can spread the disease, and usually the people, they are sick for nearly a month. Some people die, but it takes can take up to a month to die. So there's no telling how many people they will be infecting during that time period where they don't have any symptoms, and it's difficult to assess right now who what is the case mortality rate, because it takes like a month to go through the disease, to maybe recover or die. So this is the big problem with that disease. So this is why when you see there's that ship in Yokohama where they found a bunch of cases. I think they found like 61 cases of the coronavirus just inside the ship. They are going to keep the people there for 14 days because that's the incubation period, you know, and the people there, they're terrified, and that how many ships like that are going to be quarantined in the next weeks and the next months. I mean, you're going to have hundreds of ships. It's going to be a logistical nightmare, like trying to find out if there were Chinese people in there that spread the disease to other people. And I mean, I don't see any end to this. Um, so in my opinion, we're going to have a pandemic that's very similar to the Spanish flu of 1918. And maybe, we have to be prepared that, okay, this disease is going to come here. We're going to have it in Canada. We're going to have it in the United States. Very soon, it's just not going to be a Chinese problem anymore. Uh, and this disease is probably going to spread to countries that have no health system whatsoever. You can think about Africa. You can think about India. India during the Spanish flu epidemic, they were the worst hit country. They had like 20 million people died there. So you can imagine if you look at the big cities in India. Uh, the people have absolutely nothing. They're living in these cardboard houses. They're in these cities they are still struggling with diseases like leprosy. Uh, you know when they get the coronavirus, they're I mean there's you're gonna have a higher case mortality rate in these places where people won't be treated. They will be just left to die. This is going to be something. And in Africa, if you look at most African countries, uh, they're struggling with with Ebola. They're struggling with some countries are struggling with the bubonic plague and stuff like this. So, they are completely unprepared to have the coronavirus, something like the coronavirus. And of course, the people who are infected, they will get basically no medical attention whatsoever. So we're gonna see a lot of tough stuff, and and that disease is going to affect us too. It's just a matter of time before we have like pockets of infection in Canada, in the U.S. And what we see right now, it's kind of sad, but it's something that was predictable. Is that now you have some of the wealthier Chinese people, and of course they don't want to be trapped in that country, which is basically keeping them in some kind of a prison, waiting to catch the disease and die. So they want to flee, and we see more cases like this in the news of Chinese people trying to flee China and lying to officials and customs to try to go to other countries and flee that place. Um, and of course, like I'm in Canada, in my country, we have probably the dumbest prime minister we've ever had. And he's got this open border policy, so he does basically has no measures in place to stop like Chinese people coming into Canada. So of course, the disease is going to come here, and of course, if we have no measures to stop or to quarantine people or basically the from what I've heard, the people coming from China or even from Wuhan, they're being asked on a card, say, "Are you sick?" And if you say you're not sick, then they just let you go. So it's completely irresponsible. It's putting our lives in danger. But this is this prime minister is the worst we've ever had in the history of the country, and you know uh, there's really nothing we can do. So I see a pandemic similar to that one, with a from what I'm seeing from the numbers, we're talking about a 5.7 case mortality rate, which means that if you get the disease, you have 94, 95% of recovering. And of course, if you recover, you will be humanized to the disease, so you won't be able to catch the disease again. So that's a good thing. But 5%, it's still you can still have like millions or dozens of millions of people dying uh, when that disease spreads like it did with the Spanish flu of 1919. And from my assessment, this is what's going to happen. Uh, no, I would say like what you should do. Maybe you should think about buying masks, gloves, sanitizer, because these things. I'm gonna tell you something. If you go to your drugstore, your hardware stores, and you're looking for masks, you're in Canada, for example. No one's wearing masks, but there are people who are buying them because most places are out of stock. And these things are being resold on the internet for like 10 times the price. So I can tell you, when the infection is here, you will not be able to find them because you can't. It's getting difficult to find them now. So imagine when people start wearing masks here in the Canada and the U.S. you will not be able to find a mask. I can tell you that. And sanitizer, probably the most important thing is to use that alcohol sanitizer on your hands all the time, and wear gloves, and don't put your fingers in your mouth, in your nose, because that's how people get the disease, and that disease can survive on surfaces. You can probably get the disease from the a doorknob uh, that someone else has touched. So it's very important to keep your hands sanitized, and possibly wear gloves also, but clean them with hand sanitizer very frequently. And the mask is, well, it's a matter of basic courtesy. Once we are aware that there is an infection, well, you don't want to look like you're gonna spread the droplets by coughing and talking. You don't want to spread the droplets of in the air, which contain the virus. So you will need to wear a mask in public. And now in Asia, in every country in Asia, even though they're not they do not have any cases yet, they are wearing masks out of respect for others, and out of and to protect themselves. So I would suggest that you look for that, and stock up on these things before the infection comes. And the second thing, you should be prepared. You should have a plan, because obviously, when the infection comes, there's gonna be like food lines. There will be food shortages. People will be told to stay at home. So the it will be hard to find food and stuff like this. So you should really have a plan to survive, for a while, and to don't wait until the last minute. Of course, if most probably your governments are telling you not to worry, but I mean, these governments, they're complete incompetence, and they won't be able to save you when it's really time to worry. Uh, when shit hits the fan, these incompetent governments, they will flee, and they will just throw you down the river, and they won't be there to save you. So you should actually plan to save yourself before this shit happens. And I can tell you for a fact, this thing is spreading fast in Asia, and it's coming here. I'm pretty sure there's already pockets here of infection in Canada. In Toronto, you have this big Chinese community. In Vancouver, you go to Vancouver, there's like 70% people are Chinese. You got this city called Richmond. Not that you can go there with the SkyTrain, and you go in that city, and there's like 9.5% of the 90% of the population is Chinese. So these people, they invite, they have family in mainland China. They've had the family to come to their house in Canada. There's no telling how many people brought the disease here in Canada from mainland China. So I mean, there are pockets of infection right now that we don't know about, but this isn't just gonna be like a Chinese problem for very long. So you really should think about what your preparations are for this. So look, I'm Ralph from iTech Pickers. If that was helpful to you, I hope you subscribe to my channel, and I'll see you soon.